I'm going to talk about implementing changes in patient behavior. Here are my disclosures. None of this will affect the talk today. But before we get into it, there's a book I just recently read called Start With Why. It was written by Simon Sinek. And it basically looks and studies large corporations, U.S. corporations, and how do they motivate their teams and innovate and develop new technologies. And like the book title says, they start with why. Okay? If you look at Apple, when they develop or modify a phone, they don't start with how they're going to change it or what they're going to charge for it. They start with why they're going to do it. And for Apple, their motivation is they want to change the status quo. So I thought I would use this framework to discuss how we're going to change patient behavior. And the areas that I wanted to focus on were specifically in consult changes in body composition, define optimal physical activity interventions, and assess eating patterns and counsel them to follow a healthy pattern of nutrition. So we all know this. This is the why. Why are we doing this? Why did we develop PC360? That we know the effect on ADT and body composition is significant. This was a meta-analysis from 8 large studies. Body weight goes up in the first year by 2.1%. BMI goes up by 2.2%, fat mass goes up by 7.7%, and lean body mass goes down by 2.8%. The sarcopenia develops within these patients. The how and the what, how are we going to fix this? Like Bob and Scott mentioned, we developed this PC360 program, kind of a guidebook or a handbook on how as urologists we're going to improve the quality of care. And if you look at when you start a patient, and this is how we develop this guideline, is that we spell out exactly what the urologist should do. We're trying to make it simple. And basically, before initiation, before you start a patient on ADT, you want to counsel them on the ADT-associated body changes. You want to talk to them about during treatment, because all patients should receive counseling on the potential for body composition changes prior to ADT and the benefits of lifestyle interventions to prevent or mitigate these changes that should be discussed. So physical activity, as Scott has mentioned, is not only beneficial for physical function and body composition, but can also improve fatigue, quality of life, mental health, and sleep. And here's a randomized controlled study that I think it was from the Duke group, Dan George's group, that looked at 163 cancer patients ages 43 to 90 that were on ADT. They were randomized to 3 exercise programs. One was impact and loading and resistance training. One was aerobic and resistance training. And another one was usual delayed or exercise for 12 months. The usual or delayed was basically they got a handbook on how to exercise. The other ones were structured exercise programs that they had to attend. All of the exercise programs improved fatigue and improved the patient's overall vitality. The next question everyone wants to know, what was the best program? And what they found in this study was that impact loading and resistance training was just as good as aerobic and resistance training, and those patients improved generally within 6 months, as opposed to the patients that just got a handbook to go exercise. They improved, but it took them longer, till 12 months. Here's the Extend trial. We talk about, this is a randomized trial as well, not a huge patient population, less than 50 patients, but this looked at enzalutamide, ADT plus enzalutamide. So not only are we just dealing with ADT, but we're dealing with very powerful agents. And how does that affect or impact their overall fatigue and performance? So in this trial, they got usual care, and then the other patients, the treated group was put in a defined exercise program where they had to go show up for 4 months and follow a program. And the results are obvious in that you see in their 5-minute walk, the blue is usual care of basically just do nothing. The red is the patients that were enrolled in a standardized exercise program. Their 6-minute walk times improved. If you look at their get up and go status when they get up from a chair, the usual care got worse, the time it takes them to stand up, while those patients that were in the standardized exercise programs saw no decline. decline. If you look at the 30-second squat, how many times can a patient stand up from a chair? Those that got usual care declined. Those that were on the exercise program showed less decline. But when you look at fact P with the fatigue aspects, their overall quality of life, and how they feel, you see that the patients on the exercise program compared to the patients that were on usual care showed significant improvement. This is just more evidence, and this is the why we need to talk with us and work with our patients, that in our PC 360 handbook, this is the how and the what, we assess physical activity to determine optimal physical activity and interventions. So what does that mean? We spell it out. This is what, as urologists, as providers, or oncologists, is what we should see. Aerobic activity, 30 minutes at moderate intensity, 3 times per week. Resistance training, 20 to 30 minutes, 2 times per week. And nutrition, healthful and balanced eating patterns, much of what we already know and have discussed. So when you look at food, adherence to a typical Western diet is associated with a 2.5-fold increase in prostate cancer mortality and a 67% decrease in overall survival. In contrast, healthful eating patterns improve overall survival by 36%. So it's interesting, we talk about hazard ratios and declines, and looking at therapeutic interventions, pharmacologic interventions. Look at how much diet can impact overall survival. It's pretty shocking. And then when you look at it in a study, this is the Physicians' Health Study, which is an interesting study that looks at tracked physicians to look at aspirin, beta-carotene, selenium, vitamin E. It involved over 30,000 physicians. There was a subgroup analysis of physicians that had non-metastatic prostate cancer. They completed a diet questionnaire 5 years after their diagnosis, and they were followed for about 10 years to assess mortality. They looked at 2 diet patterns. They called it the prudent diet pattern, which is fruits, vegetables, all the good stuff, the stuff we're supposed to eat, and compared it to the Western diet, which is higher intake of processed foods, red meats, high-fat dairy, and refined grains. Bottom line is the Western pattern diet was significantly related to a higher risk of prostate cancer, specific and all-cause mortality. Comparing men in the highest versus lowest quartile of the Western pattern, the hazard ratios were 2.5 for prostate cancer-specific mortality and 1.67 for all-cause mortality. The prudent pattern, again, that's the fruits, vegetables, chicken, and fish, was associated with a significant lower all-cause mortality, and the relationship with prostate cancer-specific mortality was inverse but not statistically significant. So again, going back to the how and the what, basically we focus in the PC 360 on encouraging healthful and balanced eating patterns. We encourage our patients and discuss it with our patients to talk about diverse and healthful diets, which includes fruits, vegetables, whole grains, nuts, and lean proteins. The Mediterranean, the DASH diet, low carbohydrate, low fat diets are all options for healthful eating. Weight reduction is obviously critical, and most of all, you want to avoid processed foods, trans fats, excessive alcohol. So in conclusion, all patients should receive counseling on the potential for body compositions changes before ADT is started, and the benefits of lifestyle intervention to prevent or mitigate these changes should be discussed at that first visit. Physical activity benefits physical function and body composition, but also improves fatigue, quality of life, mental health, and sleep. Adherence to a typical Western diet, his pattern is associated with a 2.5 times increase in prostate cancer mortality and a 67% decrease in overall survival. In contrast, healthful eating patterns improve overall survival by up to 36%. Thank you very much.